If you clicked on this video, you probably just had a baby, so first off, congratulations. Your baby has just arrived, and you might feel like your body is a disaster right now, but don't worry, it will get better. In this video, I'm going to talk about how to recover from delivery, common problems you might run into, and what to do about them. But first, you are watching in the Health and Medical Zone. And if you're new here, being in the Health and Medical Zone means being in good health and spirit. So if you like being healthy and happy, click subscribe, because you are in the right place. In this video, I'm going to be talking about bleeding, C-section stitches, vulvar stitches, breastfeeding, your first bowel movements, and postpartum depression. And at the end, I'll go over warning signs to watch for that could mean something more serious is going on, so make sure to stick around for that. So first off, bleeding. You are going to be bleeding heavily for a week or two, but it will gradually taper off. So let's talk more about that. Postpartum bleeding is called lochia. It's mostly blood mixed with fluids and endometrial tissue. It starts off dark red, then fades to pinkish brown, and finally to a whitish yellow color, and then it stops. While you're in the hospital, I recommend wearing baggy clothing, especially in the first 24 to 48 hours. Your nurses are going to be checking your bleeding and your stitches quite often, and you want them to be able to see easily down there. So wear really baggy sweatpants or pajamas. And if you had a C-section like I did, they'll also be checking your incision frequently. Honestly, you can just relax in the hospital gowns. That's what I did for the first few days. That way, you don't have to worry about getting blood on your own clothes. The nurses can check whatever they need to check, and everyone is happy. Now, your nurse is going to give you those one-size-fits-all mesh underwear. They look ridiculous, but you are going to love them. You won't care if they get blood on them, which they will. They're really stretchy, and they hold the large pads that the hospital also provides. On the day you deliver your baby and the day after, go ahead and put 2 pads in there. You're going to be bleeding a lot, like a really heavy flow. Even if you delivered by C-section, wearing 2 pads at first will help you avoid more overflow messes. And as a side note, whatever is in your hospital room is yours to take. I mean, not the lamps or the chairs, but whatever is stocked in the bathroom is yours. So take the mesh undies, take the pads, the diapers for your baby, the wipes, they're all yours. You've paid for them, so make sure to take them before you go home. Once you get home, you need to keep an eye on how much you're bleeding. Depending on your activity level, some days may be a little heavier and some a little lighter. But overall, it should be getting lighter and lighter. You should never be filling a pad faster than every hour, and if that happens, call your OB. At home, make sure you have all the pads and supplies you need. I recommend heavy flow pads. Pick the ones with wings if they're available, because that helps prevent leaks. Get overnight pads as well. You could also consider postpartum pads or incontinence pads to place on your bed for the first few weeks, so if you do have overflow bleeding at night, you won't stain your sheets. Or you can just make sure you have a mattress protector that works too. You should not be using tampons, menstrual cups, or any other products that go inside your vagina. Nothing should go inside your vagina. A good rule of thumb is 6 weeks, maybe sooner, but only if your OB or midwife has examined you and confirmed that everything is healing properly. The reason is your vagina has just gone through a lot, and what we call pelvic rest is really important for healing. You also don't want to use products that block the flow of blood. You want that lochia to come out freely. So pelvic rest for 6 weeks, or until your OB gives you the okay. Let's move on and talk about your healing down there. So to avoid any confusion, when I'm talking about the external genitalia, I'm referring to the vulva. the inside where a tampon goes that's called the vagina. Whether you tore or you have stitches down there or not, the vulva is remarkably good at healing. But there are a few things you can do to make the healing process more comfortable. So first off, the vulva will be really sensitive at first. And sometimes when urine touches it, that can cause some burning. Now, at the hospital, they usually give you a squeezable plastic bottle called a peri bottle, and this becomes your best friend, especially in the beginning. Fill that bottle with warm water. I personally prefer warm, but you can use cool if you like. Then when you sit down to urinate, spray the bottle right on your urethral opening. This helps dilute the urine and prevents that burning sensation. You can also spray it all over the vulva to help clean off any blood or urine down there, because you want to keep the area as clean as possible. Wiping with toilet paper can be uncomfortable, especially if you have stitches, so spraying with warm or cool water helps rinse everything off. Then just pat dry with a clean cloth. You can use toilet paper to pat dry, just wrap it around your hand. I think that works a little better than crumpled toilet paper, which is more likely to leave little wet pieces behind. Now, a few things you can do to soothe the itchiness. You can take sitz baths. You can do this in your bathtub, or you can buy the little basins that sit over your toilet. Both work just fine. Fill the tub or basin with a few inches of hot water, not hot enough to burn you, but warmer than lukewarm. I usually recommend adding some Epsom salt to the bath. It's really soothing. Another thing you can do is pick up a topical numbing spray. These contain a similar ingredient to what they use to numb you before stitches. It's called benzocaine, and it provides a nice numbing effect that can give you some pain relief. You can also get postpartum reusable cold packs. They're shaped like a pad, and you can put them in the freezer or even the microwave if you prefer warmth, whichever feels best for you. Then you place it down there under your underwear. They don't absorb blood, so just keep that in mind, but they can be really soothing. Overall, you don't need antibiotic ointments or band-aids. If you had stitches, they're absorbable. You won't need to have them removed. If you had a C-section, those stitches are usually absorbable too, unless you had staples or your OB tells you otherwise. Now, for some women, constipation can be an issue, especially if you were given pain medications that are stronger than ibuprofen or naproxen. Pain meds can cause constipation. Also, the iron in your prenatal vitamins can cause constipation, which, by the way, you should still be taking. So if you're not having bowel movements as often as you normally do, or if your stool is harder, or you have to strain, you might want to ask your OB if you can take a stool softener like Colace. One common problem related to both constipation and delivering a baby is hemorrhoids. If you develop hemorrhoids, you can try pads that contain witch hazel. They help soothe and promote healing. Also be sure to drink lots of water, and you can use over-the-counter hemorrhoid ointment if needed. But always remember to talk to your provider about any issues you're having. Let's move on and talk about breastfeeding. If you choose to do so, it's amazing, but it can also be painful. So first tip, at the hospital, they have breastfeeding specialists available to you, so use them. If possible, have them there the first time you try to get your baby to latch. Yes, babies instinctively know how to suck, but you still have to help them latch properly, and it will save you a lot of discomfort. But even with a properly latching baby, there can still be some struggles. You only need it to cover your nipple, not your whole breast, so I recommend cutting them in half. Try it helps them last twice as long. Now I'm going to move on and talk about postpartum depression. I will be doing a separate video entirely about postpartum depression. I think it's a very important topic. I think it needs to be talked about more, and it definitely deserves its own video. but I do feel it's important to cover it here as well. Being pregnant and delivering a baby is a huge hormonal shift for your body. There really is nothing else like it. Add to that all the physical changes that come with pregnancy, the miracle of delivering a baby, and now having to take care of a tiny human being. That is a lot. So I'm really glad that postpartum depression is something that's more openly talked about now. There's nothing to feel ashamed of or embarrassed about. So let's talk about it. Sometimes people mix up the terms baby blues and postpartum depression as if they're the same thing. Baby blues, which can also be called postpartum blues, are considered milder and usually go away within 2 weeks after delivering your baby. You might feel more anxious, you might feel happy 1 minute and crying the next, and you might have trouble concentrating, and this is actually pretty common. But if those symptoms last longer than 2 weeks, or if they feel more severe, you could be experiencing postpartum depression. On top of feeling anxious or sad, symptoms of postpartum depression can include trouble sleeping even when the baby is sleeping well, difficulty getting out of bed because of low energy, feelings of guilt, feeling overwhelmed, or feeling like you can't take care of your baby. If you're feeling that way, talk to your medical provider or your OB and let them know what's going on. They may recommend medication, therapy, or sometimes both. Tackling postpartum depression from multiple angles is often the best way to help you feel better faster. Now, if you ever have thoughts about hurting yourself or your baby, you need to go to the ER so they can help you right away. You can also call an ambulance if needed, and there's also the National Suicide Prevention Lifeline available. Now, as promised, I want to go over some symptoms that you should absolutely report to your OB or midwife right away. There are a few life-threatening complications that can happen postpartum, so it's important to know what to watch for. Having one of these symptoms doesn't automatically mean you have a life-threatening complication, but you do need to let your OB know so they can decide what needs to be done. If you have a headache that's worse than usual or different from your typical headaches, abdominal pain with diarrhea, significant vulvar swelling, heavy bleeding like bleeding through a pad every hour or more, or if you develop a fever, be sure to call your OB right away or go to the ER. If you experience chest pain, shortness of breath, or a seizure, go straight to the ER. You can call your doctor too, but go to the ER. This isn't a complete list of every possible issue, and if you're ever concerned about any symptoms you're having, always reach out to your own OB. And just a general reminder, make sure you follow up with your OB for your postpartum visit. That's when they'll examine you, make sure everything is healing properly, and answer any questions you may have. Also, and finally, just a reminder that this video is meant to be educational and informative. It's not intended to diagnose or treat you. So if you have any medical concerns, please be sure to talk with your own OB. But if you liked this video, please give it a thumbs up. That always means the world to me. And use the comment section down below to brag about your brand new baby that I know you adore. I love reading about your deliveries and your sweet new little ones. Thank you so much for watching.